Hello everyone. So today I'm going to talk about prostate cancer. So the prostate cancer is a type of cancer that starts in the gland cells of prostate, which is only found in males. And the prostate is part of the male reproduction system. And so, like any other cancer, the prostate cancer is influenced by a combination of genetic, environmental, and behavioral factors. And the family history under the genetic factor family history, individual with a family history of prostate cancer are at increased risk. Specific genetic variants such as those in the BRCA1 and the BRCA2 genes are associated not only with prostate cancer but also with other cancers as well. So besides the family history, inherited mutations, certain inherent mutations can increase the risk to prostate cancer as well. Mutations in genes involve the DNA repair process, such as HPC1, HPC2, have been identified. And the environmental factors, so age is actually the most significant risk factor for prostate cancer. So for the male over age of 50, the risk of getting prostate cancer is increasing than the younger generation. And race and ethnicity, so there are notable race and ethnic disparity in prostate cancer. As a matter of fact, African American men have a higher incidence, and the reason are likely a combination of genetic, environmental, and healthcare access factors. And lastly, will be occupational chemical exposures. So the prostate cancer is related to if your job or any other daily activities could be exposed to chemical exposures, that could lead to increased risk to prostate cancer. So how AI can help assessing the risk? So the AI models can analyze genetic data to identify specific variants associated with the prostate cancer risk, which could help individuals understand their genetic predispositions. So you can use AI machines to test your body to see if you have any genes that mutated or any genes that could lead to increased prostate cancer. You can prepare yourself earlier. So AI models can also analyze medical imaging data to assist in identifying subtle patterns or abnormalities indicative of prostate cancer. So AI models today can read the image better than human, so they can to separate out the risky images they can notify people the potential risk of getting prostate cancer. And so in the U.S., according to National Cancer Institute, there are estimated 288,000 new prostate cancer cases, which is about 14% of total cancer cases overall in the entire U.S. And from the chart, you can see that so people, the men with under age 65 to 74 has the highest rate of getting prostate cancer, which is 41%. percent, almost close to half the entire cases. Then you can see the 55 and to 54 bracket is really has a bump up, so which represent age is really the main factor that leading to prostate cancer. So in the chart, you can also see that, probably couldn't see clearly, but African American man has the highest rate of getting prostate cancer. And however, the total cases of getting prostate cancer over the years has been relatively stable and slightly decreasing. So which is in the U.S. So in worldwide, according to cancer.net, and an estimate 1.4 million men were diagnosed with prostate cancer in 2020, and about 60% of the entire total cases are diagnosed in people 65 or older. However, the death rate for because of the medical technology and also the healthcare access been increasing, and so the death rate has been dropped by half due to early screening and early treatment in prostate cancer. So as you can see, so here's a picture of the prostate, and here a picture of male reproductive system, and you can see the prostate is just located just below the bladder at this area, in front of the rectum, and is about the size of walnut. And and when the cancer develop here's the location that cancer develop. And here you can see how the cancer develop. When the man has prostate cancer, the abnormal cell grow and form tumors. It's like right here, malignant tumors around the prostate. So, and sometimes the cancer cells stay within the prostate gland, but sometimes they can spread into other parts of the body as well. So the prostate cancer is often classified as adenomyocarcinoma, which is a neoplasm originating from the glandular cells of the epithelial layer in the posterior lobe of the prostate. So here you can see the different stages of prostate cancer. So you can see in stage 1 the tumor just start forming, and stage 2 is it continue to grow. Stage 3 is about to spread into other cells. So stage 4 is actually starting to go into other cells, potentially going into other organs. At this stage, it'll be too late for treating this cancer. So as a result, if the prostate is left untreated, the cancer can progress and potentially leading into more extensive local invasion and distant metastasis. So symptoms of the prostate cancer, according to CDC, usually the first symptom you experience a urinary symptoms, a difficulty urinating. Prostate cancer can obstruct the urethra, leading to difficulties in initiating or maintaining a urine stream. and so frequent, it also lead to frequent urination. Irritations or obstruction caused by the tumor can result in increased frequency of urination. And the other symptoms, hematuria, which means blood in the urine or semen. Prostate cancer can cause bleeding, leading to the presence of blood in urine or semen. So, and also you could lose control of bladders, a lot of control of bowel, and so you can't really control your urine or control your ability to when to go to restrooms. Sometimes also can cause a lower back pain or pain in the hip or chest. Also sometimes the common symptoms. So the diagnosis of prostate cancer is usually biopsy is usually the main tool for diagnosing prostate cancer. But a doctor can use other tools to help make sure the biopsy is made the right place. For example, the doctor may use critical ultrasound or MRI to help guide biopsies. So with the transrectal ultrasound, a probe the size of finger is inserted into the rectum, and the high energy sound waves are bounced off the prostate to create a picture of the prostate called a sonogram. So, and on the other hand, MRI can use magnet and radio waves to produce an image on a computer. So that's the two ways you can diagnose is whether or not if you indeed getting the prostate cancer. And treatment for prostate cancer is mainly recommended is surgery. So prostatectomy is operation where doctors remove the prostate. So radical prostatectomy removes the prostate as well as the seminal vesicles. On the other hand, the radiation therapy can also help using high energy rays to kill the cancer. So there are two ways for using the radiation therapy. Is external radiation therapy. A machine outside the body directs the radiation at the cancer cells, or the internal radiation therapy. Radioactive seeds or pellets are surgically placed into or near the cancer to destroy the cancer cells. So how AI play a role in the entire prostate cancer? So with the development of AI, artificial intelligence, it can identify the pictures of the prostate cancer, and the predicting tumor margins, actually more accurate predicting tumor margins than MRI, and potentially improving the effectiveness of the focal therapy, standardizing treatment margin definition, and reducing the chance of getting recurrence. Basically, when we do MRI or ultrasound, we basically using human eyes to look at the result and give it an evaluation whether or not the patient has the prostate cancer. When we're using AI, it will be machine to make a difference, to look at the images of the MRI ultrasound, to match all the data, the patterns in the data center and data center will accumulate hundreds of thousands, if not millions, of patterns to diagnose the patient whether or not they can get whether or not they indeed have the prostate cancer or not. So yeah, so that's all I have in the prostate cancer presentation, and thank you very much.